Hello, everyone. Good morning to Asia, good afternoon to the Pacific, and good evening to Americas. I'd like to welcome all of you to the APRU Multi-Hazards webinar series, Health, Climate Change, and Innovation in Disaster Risk Reduction. This webinar is organized by the Association of Pacific Rim Universities, APRU, Multi-Hazards Program, and the International Research Institute of Disaster Science, IRIDIS, in Tohoku University in Japan. I'm Takako Izumi, Associate Professor of IRIDIS in Tohoku University and Program Director of APRU Multi-Hazards Program. APRU is a network that consists of 60 universities in the Pacific Rim from 19 economies, and its international secretariat is located in Hong Kong. You can receive more information on the APRU, including various programs such as Global Health and Sustainable City and Landscape, and a number of events on its website. Tohoku University in Japan hosts the Secretariat of APRU Multi-Hazards Program. The program has been working to strengthen the collaborative research on disaster science among APRU University member universities and contribute to international and regional discussions for DRR policy making through various channels and platforms. For example, we organize summer school every year in Sendai Tohoku University. However, due to the COVID-19, the last 2 years, we did not have that opportunity. But next year, we hope we will welcome you to the more activities in Sendai. Then so far we have organized 12 webinar series and in the last 2 years and attended by more than 2,800 audience. So today we will have excellent 3 speakers from Chinese University of Hong Kong, Tonkin and Taylor International in New Zealand, and UNDP Bangkok Regional Hub. While you're listening to the presentations, I would like to encourage you to send us questions using the Q&A function. After each presentation, we will have a Q&A session to answer those questions. So now I would like to introduce and welcome the first speaker, Professor Emily Yin Yan Chan. She serves as Professor and Assistant Dean at Faculty of Medicine and Professor at JC School of Public Health and Primary Care, the Chinese University of Hong Kong. And she is director of the Collaborating Center for Oxford University and CUHK for Disaster and Medical Humanitarian Response, the Center for Global Health, and the Center for Excellence of Integrated Research on Disaster Risk. Her research interests include disaster and humanitarian medicine, climate change and health, global and planetary health, and human health security, and health emergency and disaster risk management, and so on. Professor Chen has had extensive experience as a frontline emergency relief practitioner in the mid-1990s, which spanned across 20 countries. So Professor Emily, Professor Chen, and we are very happy to have you. Floor is yours.
Okay, thank you very much. Let me start by trying the sound system. Does it work? I assume it's okay. Okay.
Very good, thank you.
Thank you very much. Let me start by sending my appreciation to Professor Izumi, because thank you very much. It's my honor to have a chance to share with you the work that my team has been working at Chinese University of Hong Kong and Oxford. And also it's a pleasure to be able to share what the health sector has been working very hard, on understanding and contributing to the DRR community. Okay, so allow me to share my screen first. Sorry. Okay, so once again, this is Emily from CUHK. Today, I actually would have a chance to share with you the work my center has been working on. CCOUC, our research center at CUHK, located in Hong Kong, is actually an academic partner of a few institutes around the world. So it's truly a multi-country research endeavor. And we are also part of the IRDL and ICOE, International Center of Excellence, which is trying to contribute, to this multidisciplinary platform to study disaster risk and the implication on practice and on policy. Let me just quickly go into health. Health sector, it's always very interesting. It's probably the most direct implication on human population in any communities. And as a result, the health sector has been also working very hard on DRR initiatives. And for that good reason, a framework, at least for the public health and the medical sector, find it very valuable. It's the Health Emergency Disaster Risk Management Framework, which was established by WHO in 2019. This is to address the important need that was advocated by the Sendai framework since 2015 about the understanding of risk or the reduction of risk in extreme events. And of course, with health, we are people-centered, and we are actually interested to look at how we may be part of the comprehensive and interdisciplinary approach to the bigger agenda of disaster risk reduction in hazards. It's a mouthful about the acronyms, but essentially what it is about prevention. At least for public health, we have this concept called different levels of prevention, and we believe that relevant implementation or interventions can be drafted. Assuming we have evidence to prevent an event from happening, which is the primary risk management, and secondary risk management, it's to ensure that health risks that may be associated after disaster may be minimized. And even to the extreme of the tertiary prevention, when yes, people already incurred impact of disaster, but we can actually reduce such impact to a point that we can save life and also potentially to reduce the cascading harm. So it's a powerful concept, which is not new, but it was repackaged and with the view of DRR. So, the latest frontier, if I may describe, is, in health, at least for DRR, is health emergency disaster risk management. And since 2015, a thematic research group was set up by WHO, which was shared and co-chaired by a few global colleagues. My own self, I was one of the co-chair, and my good colleague, Professor Virginia Murray, and also a few other colleagues around the world. I will actually mention a bit later. Essentially, with this group, we mapped out a health research agenda, which may be relevant to DRR and can contribute to various global policies. And with this agenda, it's probably most interesting to think about, at least from the health sector, what is an agreed definition of hazards or classification of disasters that's relevant to our agenda of evidence-based, because we know that with multi-hazards that is, important around the world. There are different scientific evidence that can support and inform policymakers. But from the health side, which is actually the recipient end, with the impact or even with the preparedness, how do we map ourselves into this discussion? With the hard work of Virginia and many teams around the world with the classification and hazards definition, today, since the focus is about climate, so I will share with you a few important aspects and case and research that it's actually plugging this into this agenda from climate change. But I will also mention that the most recent COVID-19. What are research that may also inform the research community, the policy community, that actually is cross-hybrid between climate and the pandemic. So let me just quickly describe to you, for the case of climate and health and DRR, okay? With the health emergency disaster risk management research agenda that was agreed and that was now currently ongoing globally for the health community, I think one of the important research gap or evidence gaps we are trying to cover is the idea of health risk associated with hazards. I would actually allow me, my dear Hong Kong, city in southern China, a few important findings. It's not just purely academic exercise that we are talking about. I will highlight to you the few important findings that actually inform policy making. And it would be interesting for, I guess, the research community in this region, Asia Pacific, and so on and so forth, to see how related research may be implemented or even maybe organized in the relevant context. Hong Kong is a city, again, very typical city in Asia that is highly urbanized, densely populated. And we actually have, as a city, a subtropical climate, okay? So as a result, our winter and our summers are not very distinct. Having said that, I mean, because of how we built our city, I mean, there's a pronounced urban headlining effect that is already known. This is the city, so we are surrounded by the sea. So from a climate change point of view, there's multi-hazards that we're experiencing. I guess this slide is to summarize, I mean, at least from meteorological or from the general physical impact of climate change. We suffer from actually impact from temperature, rainfall, sea level rise, and extreme events. And as we were to speak, as of today, as October, we experienced the second typhoon within the week. Typically in the old days, I mean, by October, Hong Kong should not have too many extreme storms or extreme events or meteorological events. But like just for 2021, I mean, we already have a storm that came 2 days ago, and we have another one as of now, real time. So this is the extreme end of what's happening in Hong Kong. So there are many meteorological impacts that are already documented and being discussed and being investigated by scientists. But how about the health impact? My team at UHK, together with a number of other disciplines beyond health, with the architecture department and a few other good colleagues, has been working on using the existing data to identify meaningful results and discussion that may hopefully improve the well-being of the community. And the way we conceptualize the health impact, it's through, again, very standard in public health, that we know that extreme temperature will affect quite a number of needs, such as basic health needs, to the change of environment, even the infrastructure integrity, and how people actually move around in the community. And the way we conceptualize the impact, it's also not just by one outcome. So we actually think how it may impact infectious disease patterns, non-communicable disease, injuries, and all the way to how does it affect death, hospital utilization, and community service use. So this is, again, a very typical concept, at least from the health sector, just to share with this multidisciplinary audience. When we think about outcomes, we think in different layers as well. We actually have outcome studies that focus on death, of different causes of death, all the way to hospital admissions, medical health-seeking behavior, self-care, all the way to symptomatic or even behavioral changes. We think all of them are very important because we know, according to classical definition of health, death is only one outcome. We know that, the well-being of individuals, physical, mental, and social well-being are all very important. So we look at it from a totality, but we have no illusion. Each of the outcomes requires different data, and each of the outcomes require different levels of sophistication in modeling. So our team for the past 12 years has been working on building the right model, and then we have published about 25 papers that talked about various outcomes. And this is the model that we've been using. We are evolving so that to share with, again, the wider audience that we're more than happy to collaborate, by the way, to share with you what we've learned, and we want to learn from you about how other communities maybe experience the same thing. Take into consideration, aside from the temperature variables, the environmental variables, all the way to social demographic characteristics, with the advantage of having local database that can support such studies. In Hong Kong, we are very special. Aside from having accessibility to the mortality data, government actually decided to have an open data process for that. And also we manage, at least during the modern process, to have the availability of our hospital database for a substantial period of time. And that gave us, a very important advantage about being able to map the outcomes. But more to describe later. But this is one of the examples of the studies that we have published. And this is an important study because we actually identified, like 10 years ago, that in Hong Kong, there is a threshold I mean, the threshold is about 28.2 degrees Celsius, which above this particular temperature, which is a daily average temperature. Daily average should be above 28.2, which people said that, well, in Hong Kong, any given day in summer will be more than 28.2, but we are talking about for a given day, if you average 24 hours, typically annually, Hong Kong will have less than 25 days, okay, that are above 28, because at night with clouds and everything, temperature will drop. So, I mean, but with of course, with climate change, with temperature, temperature increase, we increase the average 24 hours, of about 28.2 degrees to now to about anywhere from 28 days to 32 days. So we are only expecting more and more increase of this annual days with such temperature. Essentially, this finding of threshold also gave us an important indication of about at-risk population. We were able to look for the stratified risk of different groups, age groups, and also the total gender. The implication on policy about this, because we know, like many good environmental health studies, not only does we have, death will occur, but there is this displacement component, which means to say when thing happens, people may die, not the same day, but a few days afterwards. That gives us an imperative that if there is policies, population health protection policies, it's very worthwhile, okay, to build policies around this so that we know that if we manage to support the community within, the threshold and the few days, potentially can prevent death and of course hospital admissions. For that, this is just a summary of the findings, which I have a few colleagues who have attended this conference must know very well by now. We actually build studies upon studies. We look at hot season and cold season and look for different thresholds. And this threshold is now used to inform our Hong Kong Observatory for their WBGT heat wave warning with different sectors to build their emergency plans. But it cannot be done by just the health sector. It must be collaborating between different sectors and have the acceptance of other stakeholders in the community. It's a lot of learning and lessons learned, but it will be for another, occasion that we will share. But I just want to point you back to this particular so-called pyramid of the outcomes that we've been mapping, our findings and study. Of interest to, the global community that may experiencing I guess maybe living in subtropical environment. Interestingly, Hong Kong is a location that has no snow. Okay, so we don't experience very extreme cold winter, but we actually find after finding studies with models that can be compared and with the same community, the same year span, we realize that low temperature still pose a much stronger effect overall on mortality than high temperature in Hong Kong as of this stage. Okay, and my colleague, Dr. Cedar Liu, actually for his work, he has been working on how temperature effects on different subgroups of the socioeconomic subgroup. And actually from his study, and once again, he actually highlights that the cold effect, despite we're talking about temperature elevations in urban context, still associated with higher mortality risk across all socioeconomic subgroups in a subtropical city like Hong Kong. But having said that, the heat effect, okay, specifically will have significant effect on lower SES. So what it means is that for cold temperatures across all age groups, for heat effect alone, the lower socioeconomic subgroup will actually harvest the highest impact. And as a result, there's an implication on social equality and more equitable policy to support, again, SES group during hot days. And of course, if we go further into the analysis, we actually are interested in looking at how gender may be impacted, which is another very important agenda globally to look at impact of hazards, right? At least from Hong Kong, we actually find there's no clear gender difference for cold effect. But female, if we go further with other studies that look at self-reported symptoms and behavioral change, female tends to be more sensitive to weather. Okay, and older age group, of course, as expected, was again proven in at least 17 of the 24 studies that has definitely a higher mortality risk across almost all study outcomes. We have studies that was published about cardiovascular outcomes, respiratory outcomes, GI outcomes, or even mental health outcomes. So, again, I'm more than happy to be in touch if any research group in the world is interested to look at our findings. The other interesting areas about urban planning. Again, urban, no, I work with urban planners, architects, good groups like APRU, from CUHK, that actually looks at, how urban planning, how, I guess, urban wind, so-called ventilation with other subgroups, other universities in Hong Kong that was thinking about urban heatwave impact, Johnny's group about wind and so on and so forth. I think what we actually found was that green space, in fact, green space density, okay, is associated with decrease of non-accidental mortality. That gives us a lot of food for thought, okay? The idea is that it's not just having green space, you have to have the right density. And that is important. Hong Kong is quite interesting. We have a lot of country parks, but most of our buildings is concentrated in certain areas, okay? So, our city is actually very densely populated in an area and then with a lot of country parks. If you look at it in totality, we have green space, but if you look at green density, it's actually another story. So again, all this evidence becomes a tool for policymaking and for further urban planning that may be useful. But I guess the important thing I want to bring up is that despite of the hard work of the team, we spent about 10 years to build this. It's not enough because climate change is not just about temperature. So we are now further ventured into rainfall studies. Again, rainfall study has different modeling because we are talking about drainage system. We are talking about additional dimension of health risks such as vector-borne diseases, because how vectors are being affected in the community. So as a result, we have a lot of work to do. Again, we are happy to collaborate with any academic research group that are interested to look at vector-borne disease, rainfall, drainage, and so on and so forth. So that was how it is. But having said that, as I promised in Chicago, that today, not only do we talk about the climate findings, we are happy to share with you further about how, at least as a health sector, I put another hat, Mother Rachel hat, the research agenda subgroup in HEDLM, we think what's the frontier from health side, is that we know that a lot of risk is compound, complex, cascading, concurrent, and even protracted for a lot of global communities. So that is one of the frontier. And it was interesting that we talk about this, at least at this very moment, because not only has this so-called frontier conceptually requires a lot of efforts. We now are in the time of pandemic, COVID-19. And with COVID-19, it gives us a natural context to study further about this. Because, if we normally talk about infectious disease outbreak, a lot of developed context to say, oh, this is not an issue for my community because we are already quite well organized and well supported or protected by infectious disease because we have the infrastructure. It's more an issue for developing context. But COVID-19 really give important food for thought for global community that we are vulnerable. Everyone is vulnerable, with infectious disease. And if you look, if you go back to the classification of hazards, biological risk definitely associated with climate, but also, signify an important risk group on its own. So then it gives us an interesting perspective. Wherever in the world, at this moment, if you do research related disaster, it's not only about, the original underlying risk, the physical risk of potential risk of floods, earthquakes, and climate temperature. We actually are now looking real time about how biological hazards together with underlying risk, how will that affect our community? So biological risk, let me just highlight quickly. Again, typically it was managed by health and the medical sector, but it's interesting because, COVID-19 is just one of the many. There's already, the pandemic influenza that we are concerned about, and there are regional and important hazards such as Ebola, and globally of our concern about malaria and dengue. Okay, and COVID-19 has been regarded as a major public health emergency of international concern since 2020, which is now is already more than 18 months. It's still ongoing. This is the situation of COVID as of 2021, October the 11th, which is yesterday. Globally, we have 237 million cases. So this is, again, I'm sure everyone in their own home context will know what's going on. Interestingly, this gives us an interesting pattern of the global pattern. Depends on when you're looking at this. At this moment, according to global statistics, the case concentration, unfortunately, or the death concentration seems to happen in North America, Europe, and South America, which is accumulate the highest COVID-related deaths. So again, this tells us biological hazards global risks, are very heavy duty. But in terms of conceptually as hazards, COVID-19 is not just biological hazard, it shows a protracted crisis. Okay, and again, if you look at it from a technical point of view, it's a non-linear transition of risk, and also there is a huge gap in resilience and preparedness strategy. And for good reason, there are, again, the discussion in the health sector, and this is published in Lancet in June by my global WHO roadmap research group. And we realized that numbers of engagements or research gaps that is currently missing. In particular, the risk communication is actually, again, highlighted to say that, whether there are ways for us to communicate with population so that people can protect themselves. And this leads to an interesting crossover between biological hazards, climate, and other physical or geophysical risks, because, again, risk communication is brought up many times, and it remains as an important topic that it's important in health. So I would like to share with you a very quick piece of research that is related to pandemic and risk communication. In Hong Kong, we actually try to map, with the interest of disasters, what's happening in the community. We do the same type of studies for other hazards like typhoons and fire and community hazards. But this one is interesting because we actually try to follow a cohort population. We have several study periods, but this is one of the studies which I must show you, is that in Hong Kong, we consider our community has went through like 3 waves, pandemic waves, and we actually managed to capture community response or community sentiments or even a behavior during phase 1 and phase 3. And we try to compare with a protracted crisis in an urban context that access to information should not be a major problem. People's literacy is supposed to be high. Okay, we want to understand like how community behavior may change and give a pointer actually for other warning discussion. So we collect our data through telephone survey. In Hong Kong, it's still feasible. We still have a telephone landline penetration of about 80%, despite of now increasing use of mobile phone. And we compare our sample with the sensors, and we try to at least find a comparable community. And we actually follow the same group of person from phase for wave 1 to wave 3. Okay, and this is perhaps the.
Emily, sorry, you have only a couple of minutes.
Okay, sure. I will be done very soon. Thank you. Essentially, this is the findings. We actually realized that with a protracted crisis, even with a community with high emphasis of concern, because Hong Kong, by the way, is one of the key communities that was affected by SARS. So to Hong Kong, major infectious disease risk is not something new, and we are a community that are used to wearing face masks, or even by now, of course, various policies. We will consider ourselves to be living in a city context with one of the most stringent policies of travel and working risk, how we protect our community. Essentially, this is the findings. We actually found that with time, since after the 3 wave, with my research group, that people intention, or at least reported practice of wearing face masks increases with time. Right now, it's actually 100% because it's by rules and regulations that we have to wear our face masks. But other than that, other social distancing practice actually decreased significantly, okay, with time, okay? So we know that there is definitely an evidence of fatigue, okay, of behavior with time. And let alone the idea that there's certain behavior that has significant decrease of uptake. For instance, the avoidance of social gathering. And of course, people say, oh, we have changes of rules and regulation. Yes, but even if we control those variables, we realize that people decided that, well, with all this potential vaccine, and with now, people realize about the risk of case fatality. People actually simply decrease the vigilance, okay? So the reason why I bring that up is because, we are actually currently not only looking at risk that is dealing with COVID-19, we at this very moment, we are collecting data to look at how people is viewing their risk that coincide both COVID and also, fire risk, and also potentially typhoon. we're in the middle of time when we're actually collecting data. My team's collecting data right now to look at how communities looking at their travel, their social gathering risk, because people, they limit their transports, during or travel during, a typhoon season, which is also place risk on their own health and injury risk. Okay, so last point, thank you, Izumi, for reminding me. I just want to point to you that there's active research going on with the health sector, because we know that this is a very precious time to understand how people view their risk if multiple hazards is ongoing. And I just want to point, a few important documents in the health sector that actually look at biological hazards and also other hazards in DRR. And this is a good work that was published by Professor Shaw, Rajiv, and Chatterjee, and a few good colleagues that was working on this area. Health sectors and healthcare is always an important sector in DRR, and we are looking at how it was integrated into biological hazards in other analysis of risk from exposure, hazards, vulnerability, and coping. So as a summary, if I may share with this wider community, that COVID, if I may remind everyone, is perhaps an important hazards in biological risk. It's a perfect time for us to understand how multi-hazards, if they occur together, what's going on in the community. We need your data. We need your findings, and we will be able to give a bigger picture about how risk groups or vulnerable groups may be comparable in biological risk and also physical risk, and so that we have formed a bigger picture for evidence for policy making. Okay, so please visit us. Our center is www.ccouc.org, which is located in Hong Kong. And thank you very much. And I'm happy to take any question. My apology again, it's a short presentation. I have a lot that I want to say. But back to you, Takako. Thank you.
Okay, thank you so much, Emily, for your wonderful presentation, which is full of information and the research analysis and data. I was very, very impressed, and I'd like to learn more about your experience. Okay, so unfortunately we don't have much time for Q&A, but just one question. Has there been community-based DRM approaches initiated or developed to respond to the COVID pandemic? You think?
Yes. Thank you, Takako. I think thank you for the question. I see from the chat it was asked by Kiko. Thank you. I appreciate the question very much. In fact, yes. Please visit. A few important platforms. For WHO, there's a platform called Roadmap Research Group that's focused on social science for COVID-19. It's on the internet, and I'm happy to share with you later about the links, again on the chat or through Takako, to the wider community. It's a research group that was gathered by WHO to look at the latest frontier about social science research community practice. It's actually more the practice side for how research maybe mapping about the lessons learned. And they actually have a few very important DRM approaches to think about this. And in fact, good experience have been harvested in India, in Indonesia, for such approach, because in many of those communities, resources and the system, the healthcare system is not robust enough to address both a pandemic and multi-hazard that is ongoing in the community, but they have good community experience. So I am happy to share the link. Yes.
Yeah, great. Thank you so much, Emily, for the information. And I really, and I think it's great idea and a concept. You mentioned the health and the DRM, the collaboration and approach. So I hope we can work together in the future. I'm really interested in that the topic as well. Okay, so thank you so much, Emily, once again, and I hope we can keep in touch. Thank you so much. Thank you.
Thank you. I appreciate it. Stay well.
Yeah, thank you. Okay, so now it is a great pleasure for me to introduce the second speaker, Dr. Vapon Fakaldin. He is an eminent hydrometeorological, metallurgical, and disaster risk assessor with 19 years global experience in water resources and climate resilience projects. His key areas of expertise are hazards of forecasting, climate and multi-hazards risk assessments, and coastal community resilience. So he has a lot of experiences, and currently he's working in Tonkin and Taylor International in New Zealand and the mentor and supervisor for postgraduate study in disaster risk management in University of Auckland. So thank you, Dr. Fakaldin, for your joining us today, and floor is yours.
Thank you, Dr. Kuko, for inviting me for this webinar. I'll be sharing more on the climate change impact as well as disaster risk reduction integration between these two fields together. While you may be quite aware of at this moment that the effect of climate change and extreme weather become more apparent, and with the COP26 that are actually coming to the next month, there has been so much jargon, so much documentation, talking actually going on in the social media regarding the climate change impact, how we can actually reduce the emission, what is going to be inevitable, and how we can actually react. So much has been going on, and probably we are quite overwhelming with all those information together with the IPCC 6th assessment report that came out recently. But it's one thing that to understand that our climate is changing, but it's also entirely different. That what does it matter to knowing what exactly it means to us as an individual? What risk are we likely to face due to climate change? Where and when it mostly could likely to strike? And then how we can actually adapt to minimize them for the future risk assessment. Obviously, I work in Tonkin & Taylor, one of the largest engineering consultancy firm in New Zealand. We cover most of the Pacific, which is our priority area at this moment internationally due to the location as well as accessibility from New Zealand. But we also quite well covered to the Southeast Asia, South Asia, as well as some part of Africa and Caribbean island. As you can see in this particular small diagram, there are complex relationships between the climate change and sustainable development in our region, as demonstrated by this cascading and compounding effect, which is exerted by key climate change indicator like carbon dioxide concentration, ocean acidification, sea level rise, and extreme weather event. And that how actually it would impact to the differential sector. Now, obviously, if you can see that, okay, this is quite common that, okay, climate is changing, it has creating some hazard, and hazard is actually impacting our sector. We all know these things, but how we actually can assess those things, that could be a little bit need to more further analyze and understand that what data actually we are feeding to understand our overall climate change risk, and how that would create our understanding the consequences and impact in our life as well as in our sector, which is quite important in this regards. And then this aspect is quite complex if you look at these things. On the right side, you can see that there are actually several frameworks. You all who have actually worked on either climate change or sustainable development goal or disaster risk reduction fields, everyone is changing to reach by 2030 the global agenda for Sendai Framework for Disaster Climate Change Paris Agreement for 2030, which is a commitment by every country. There has been a sustainable development goal. There is new urban agenda, and there are many other regional framework exist. But on the left side, if you look at on the diagram, it's actually a 4-dimensional aspect. You're trying to look at what is happening now to what is happening up to the century. And then you try to looking at what are actually global phenomena, national phenomena, regional, as well as subnational and local. And on the other side, you actually need to feed your differential sector, which is like an infrastructure, ecological, economic, human, and political environment. But top of that, you have climate change hazard, its exposure, as well as vulnerability to understand the risk and going to the impact assessment. So it's not so easy in that sense to understand its overall compounding as well as cascading impact of climate change into the development. And then my colleague Sani probably quite well cover on the development side of it. If you look at the IPCC risk framework, so IPCC talks about, IPCC actually did a quite well job especially all other fields, to making sure that we used a consistent risk assessment framework, which is a risk is a function of hazard, vulnerability, and exposure. And then the sixth assessment, they try to cover more on the cross-cutting approach, like a handshaking to every other working group, that how we collaborated to understand what are the climate change risk and how we actually adding more on the impact or response side of it. And as you can see that CEREX has been started with that process in 2012 to risk is a likelihood versus consequence of risk is a function of hazard, exposure, and vulnerability. And then top of that, we try to start talking about, because risk is not all. You may have 100 risk, but you need to understand actually same risk has a differential consequence to different area, differential sector, differential community. So what are the consequences the risk actually brought, so that we can prioritize the risk and go for next level of adaptation option, or how we actually understand that based on the consequence, understand our appropriate impact and create a response option. And I think the sixth assessment try to cover those aspects quite heavily to looking at the response and impact, so that actually it talks about the reality that how we can actually measure and how we can actually manage our risk assessment. And obviously, Emily actually shared quite a lot of detail about the health aspect and how actually important the health data for risk assessment. But one of the things just I like to share, one thing that the health or the COVID and pandemic actually gives us a quite good reality that how and why actually we need a dynamic preparedness or response or contingency plan, because each time you are facing a wave, it's bringing you differential phenomena. And then so your potential response would be quite different at each level. So you need to have a quite robust, dynamic response option to managing the risk. We recently in New Zealand, we didn't started quite far along actually our overall climate risk assessment. So we started the climate risk framework, which is 2019. We come up with the standard guidelines for our country that what does it means to us. And as well as in our community, we have a quite strong indigenous influences, our Maori culture and context. So how actually it can woven our Maori context and culture into the overall scientific domain, and how we can actually make sure that we have a robust risk assessment process in place. And based on the framework that we developed, that leads to us to go ahead with the National Climate Change Risk Assessment, which has been done in last year in 2020, which is the first National Climate Change Risk Assessment. It provides a picture of how the New Zealand may be affected by climate change related hazard, and what would be the government priority action and adaptation plan based on the risk assessment. Overall, we come up with a total 10 particular risk. And obviously, we can see that in the 5 different domains. So in the natural environment, it's coastal ecosystem, indigenous ecosystems. In our human dimension, it's more on the social cohesion and well-being, as well as excavating and creating new inequalities. In the economic sector, it's more on the government economic cost, as well as financial system instability. In the built environment, it's more for water supply. So water is quite critical for us, and building and communities. And in the governance sector, is more on the maladaptation, as well as across all domain and institutional arrangement for how the cross-cutting or coherence between each organization could work together. But obviously, when you look at the more on the climate change disaster risk reduction, our climate change talks about more about like century or what is happening on the after 30 years or after 50 years. But as the extreme weather event is actually created by climate change. So neither our traditional hazard assessment nor our climate risk assessment, or even such as like TCFD, which is like a mandatory requirement for the agency, are designed to anticipate near real-time climate enhanced extreme event. So like the recent heat wave in the Pacific, or maybe the flood in Germany, which you can actually already remember, or wildfire in Greece and California and Australia, these are all actually, we are blaming that, okay, these maybe due to the climate change, these are actually exacerbated or actually enhanced. But how actually we should know or incorporate those into our overall risk assessment framework is quite important. So it is quite important to look at more on the integrated approach, that how the weather and climate works together hand in hand, and how that could help us to better understand and better prepared for this kind of response option. So the different timescale weather, water, and climate information is essential for our decision making, allowing our users the opportunity to put appropriate action. We also started working on a sort of seamless integration to looking up weather, climate interaction, and to better understand our risk as well as the impact. So as you can see that you have an emission scenario on the left side, then that's on the climate science. And then you have a climate projection. You have, other than climate projection, like annual or decadal climate projection, you may have a long range forecasting, you have an extended range forecasting, you have a medium range forecasting and short range forecasting, and how all these things could help you to understand your climate related hazard. And that could lead you to understand physical risk assessment as well as transitional risk assessment, so that you can actually compare that what are your litigation risk, your liability risk, your other risk than the physical risk assessment. And that could potentially lead you to the loss modeling, because end of the day, everything is actually dollar value, that how much money you are spending or how much money you are losing. So if you know actually how much money has been lost on the past for each disaster event, you'll be able to actually better understand how much you could actually predict a probable loss for the future. And then you can actually place those kind of risk transfer or risk assessment kind of things. And then which could lead you to more on the climate mitigation and adaptation measures by collaborating with all the differential agencies that are working together. The next aspect, again, when you're looking at the overall the climate change commitment by the government, because we all, because the Paris Agreement is a commitment, it's a mandatory commitment, so you have to follow these things, and that leads us to better understand or provide those national adaptation plan or national determined contribution. And if you look at those national determined contribution or NAP process, the DRR are actually often quite not well integrated into the that process itself. Neither is there has been so much climate risk assessment has been done before we actually go to the NDC or NAP process. It's more talks about mitigation aspect rather than less on the adaptation. We recently did a study under the UN DRR, and the document is actually published. Anybody can have to look at these things, and we try to cover the more than 10 countries in the 5 continent to understand actually how the NDC and NAP process has been developed and where is the gaps and how it could be enhanced. So one of the things that we try to look at the geographical region, NAPs, NDC that are in place, the population coverage, World Risk Index, development category, as well as the income level. And then based on that, we actually selected these 10 countries to understand how the DRR has been integrated. And to understand these things, we try to come up with a coherence framework, which talks about more on 6 major domain to look at institutional, systematic, operation, data management, knowledge management, and finance. And each of those domain we try to cover with multiple indicators, so that actually it gives a little bit granularity and as well as a little bit semi-quantitative analysis to understand what could be the risks look like. And this is just a snapshot of an example of, I just put together one for Sri Lanka and one for Fiji, where you can see the red dot means like it is quite weak, orange is average, and green is strong. So when you have this kind of semi-quantitative assessment, you know that actually within the operation, you maybe need to more enhance on the monitoring and evaluation framework. In the data management, you look at more on the responsible organization, or you in the finance, you try to look at that how actually the financial strategies or financial organization need to be worked on. So that gives a little bit quite easy for the government or the policymaker to implement quite pinpoint specific responses. And finally, we try to come up with some recommendation for the country that the country need to come up with clear roles and responsibility for institution who is responsible for adaptation and disaster measures. One of the clear identification that most of these things has not been done through proper climate risk assessment due to data gaps, how we actually understand the data gaps into the overall process so that the NAP is actually provide you a legislation guidelines. Sorry, then NDC can provide you the legislation guidelines. NAP would be a driver, and within that, how we can incorporate the disaster risk reduction activities within the NAP process so that the investment can look up and follow up some of those activities. And lastly, I also work as a chair for the data working group for co-data, as well as IADR, which maybe Emily just mentioned to you. We try to provide a lot of capacity building and awareness activities and engagement through the stakeholders. So there are a newsletter that has been published every month on data and newsletter. Feel free to subscribe. And there are also a lot of webinar as due to the COVID, we actually don't fly in or do the physical. It's more on online, and all actually has been archived in a small single pages, all the webinar as well as event presentation. So feel free to look at those things that maybe find you if you're interested on climate change, data and disaster risk reduction. So with these things, I think that's my last slide. Thank you so much. Feel free to ask me any question you may have.
Thank you so much, Bapon, for your wonderful presentation. And also you share a lot of data and research and also the publications as well. So we have one question from the audience. When will New Zealand plan on implementing ARG GCM data for the purpose of modeling the impacts of climate change on storm water design?
So in New Zealand, we have some crown agency like NIWA, who actually responsible for providing us either a high resolution downscaled or updated climate change scenario and modeling database. So based on the data actually that we receive from the Crown Agency, that is actually the standard data or baseline data we try to use. So at this moment, I think the data is actually, the year 6 data is actually processing, and our Minister for Environment, they're trying to purchase all those data for overall the risk assessment based on the new climate change scenario. And those would be all available for other agencies as well as practitioners or other researchers to work on that things. In a country like New Zealand, we have an open data policy. So data is a public goods, and data need to be shared to the public domain for the research activities. But even though that's maybe not the case, sometimes we also feel a struggle to finding the data, or because there are many data is underutilized, there is no metadata standardization, and there is no interoperability of the data. So that makes quite challenging. So we always try to promoting the FAIR principle, which is like data should be findable, data should be accessible, data should be interoperable, and data should be reusable, so that it makes everyone quite easy to access the data for their overall vulnerability assessment to understand the better risk.
Okay, thank you so much, Bapon. And you also mentioned about, just mentioned about data, the difficulty of collecting the data, and also but you also mentioned we need more assessment focusing on the climate change. So how we can strengthen this kind of the gap? I mean, we can fix it.
Yes, I mean that's one of the biggest challenge, I think, for whoever actually working on whichever the field, either you're a researcher or you are a domain expert. We always try to conclude in any kind of assessment that there was actually lack of data. And I'm actually listening on my last 19 years career that there is always a missing in data. There is always a challenge on the data. We actually did a small study in the Arab region last year which is like a regional risk assessment for Arab under the UNDRR. And one of the chapter actually written on the vulnerability data, because that's the most critical data, because that's collected with the all domain. So the conclusion was that it's not true fully that actually there is no data availability. there is data availability, but data may be underutilized, or we don't know actually how to access those data. And there is actually maybe a interoperability issues. So you may have those data collected, but never stored. You may have data not properly screened, data not metadata standardized. And if you look at our institution who actually deals with the data, it's like our National Statistics Department. So that's like a bread and butter for them, to metadata standardization or data collection process. But they still actually works a little bit on the traditional mode. They are not actually quite responsible for holistic integrated data collection system into one single place. Right now, they are driving some of the SDG initiatives that how actually the SDG data could be collected and stored. But other than SDG also actually cover like 1/3 of Paris Agreement data or 1/3 of DRR related data, because there are actually quite common elements, indicator that we are actually commonly measuring those things. But due to the silos on the organization or the responsibility by the organization, because DRR is maintaining by the National Civil Defense, whereas climate change is by the Ministry of Environment, and sustainable development is by the statistical departments. So there is a less argument and less cooperation who will be actually be the custodian of those data that are actually collecting from the field and store it into proper systematic way. So there has been a lot of process going on, like by the UNEC, that how actually we make the data more comprehensive, how we can bring in the disaster related statistics. So hopefully by a few years that could shape up quite well. But these are the challenges at this moment, I think, in the global context.
Yeah, thank you, Bapon. Yes, I totally understand the difficulty, and also that issue is there for, I think it's quite a long time, but we really need to catch up to fill in the gap. So, and you also mentioned about the multi sort of the sectoral collaboration to tackle the climate change and also the the compound disasters and things like systemic risk as well. So what would be the suggestion for you to all of us, how we can collaborate together, private sector, academia, and also that international organizations?
I mean, the COVID could be a quite good example, actually. It shows us that why we actually need to work together as an engineer, as a health worker, as a other socioeconomics, because the situation is quite complex. And this complexity is a new normal for us at this moment. So to understand this kind of complex, which is also quite emerging, because we never faced those things. Like in my lifetime, I never saw another pandemic. And I'm not even a pandemic expert, but what I have expertise on disaster response or climate change, I can bring my knowledge, and with talking with a health professional, they can actually give me some idea where does it brings, and then we can marry somewhere in between to sharing our knowledge and activities. And I think that's where actually we are leading now, that because the challenges we are facing is quite emerging, and it's necessary to have a disciplinary approach. And without a transdisciplinary approach, this kind of emerging risk or emerging solution could not be possible. And I think that needs to be understood by every sector, that, okay, no, we cannot work in a silos, even though we have our subject matter expertise, but we need to have a collaborative environment. And I think someone needs to be put this kind of ecosystem so that all these differential agencies and group can work together in a collaborative manner.
Okay, thank you so much for your really inspiring comments and also the presentation. I hope we can work together to tackle those issues in the future. Thank you so much, Bafon, for your joining us today. Thank you. Okay, so next I would like to invite our last speaker today, Mr. Sani Ramos J. Quiros. He's a senior advisor and team leader of disaster risk reduction and recovery for building resilience, UNDP Bangkok Regional Hub. And prior to his current position, he was the Regional Disaster Reduction Advisor and Practice Coordinator for UNDP's Bureau for Crisis Prevention and Recovery in Asia Pacific Regional Center in Thailand since 2012. And he has a lot of experiences in DRR and disaster recovery as well. and he has more than 30 years experiences in this field. So we are very happy to have you, Sami, and floor is yours.
Thank you very much, Takako, and good morning, everyone. The benefit of speaking last among the three very good speakers is that I still have the peak of participants, which is now 140. And congratulations, APRU, congratulations, Takako Izumi, and colleagues at APRU and IRIDES for bringing together such a diverse group of participants. UNDP does not have a collaboration formally with APRU, but certainly we have a very strong and formal collaboration with Tohoku University IRIDES. We are key partners in the establishment of a unique private sector, academe, UNDP, and government collaboration to strengthen capacity on data statistics. And this was launched during the Sendai World Conference DRR in 2015. And this is what we call the Global Center for Disaster Statistics. And we are currently supporting 15 countries. And I acknowledge the presence of dear friend Yuichi Ono in the audience, who is the director of and the lead in the Global Center for Disaster Statistics. We certainly, in terms of dissemination advocacy, UNDP is also a partner of the World BOSAI, the Global World BOSAI Forum annually, and that's how we will disseminate our advocacy, particularly for UNDP in the resiliency in the 2030 Global Development Agenda. 30 years, indeed, I've been working on this, and by 2019, disaster risk reduction, or DRR, as a professional practice is 30 years old. In 1989, actually, member states of the United Nations General Assembly declared an international decade for natural disaster reduction. And beginning in 1990, the decade was intended to support and harness international cooperation in reducing loss of life, property damage, and social and economic disruption caused by disasters. Now, in this slide, many of you will observe that the DRR practice continue to evolve. It's an interesting profession that I have been involved in. It continued to innovate, to invent itself, and certainly it will continue to be innovative and to be evolving with the challenges. There are several milestones, and the last milestone was the Sendai framework for DRR in 2015, which was held also in Sendai. And to recall, the approach then prior to 2015, just to compare where we are right now compared to before 2015, is that we look at simply identifying risk, reducing risk, and managing residual risk. And there are positive outcomes. And let me cite some of those from UNDP programs. Countries or economies who are present here from India and Bangladesh and several ASEAN region, governments and even researchers were talking about success of reducing mortality because of strong early warning systems, success in recovery, sustainable recovery, and in many cases, they are not just going back to normalcy, but in fact, they're more viable. For example, in the case of Aceh, prior to the tsunami, we knew that the infrastructure were very little, but the recovery and rehabilitation was so intensive after the tsunami, and we have seen better and much improved infrastructure and access to basic social services for various individuals. Now, we know that DRR practice has a strong as established core, but it's still unstable. And the question for us now is whether we're up to the challenges that colleagues have identified previously vis-a-vis pandemic or vis-a-vis climate change. Look at financing, for example. It's it's actually very sad to say that international financing is still very small at 40 cents in every $100 spent on international aid. And this money, small money, is even favorably supporting emergency response or post-ante, and very little, 12%, are in DRR and prevention. Now, when you look at the domestic financing, we did a study in several countries with the Asian Development Bank. Disaster financing is very low. And similarly, the observation is that one reason is that disaster information are rarely used to inform development planning. Meanwhile, with improving realization of the complexity and urgency to address our Earth's problem, Bapon mentioned this, several other policy global frameworks were agreed. And these are the six spheres with a common purpose tagged as the 2030 Development Agenda. And convergence, or the related lexicon of the whole of society, whole of government approach, is the key change manifested in the notion of resilience and is common to all frameworks. The SFDR 2015-2030 actually adequately described this in a goal statement, and you can read here the expected goal. There are 7 global targets and the 4 priorities for action. I'll just show you very quickly what these are. I will not cite them. You must know about this target and priorities. But what should be different? The recognition that risks have now become a complex issue. Risk is not due to the occurrence of natural hazards alone. We don't want to call disasters as natural disasters anymore, such as the occurrence of the earthquake, but also about the interconnectedness between the development decisions policymakers make and the individual decisions people make, such as what you do vis-a-vis the COVID pandemic. The behavior, public attitude, and actions will determine your vulnerability. But these choices had and can create new exposure and vulnerability to shocks. This can include, by way of example, the economic growth policies vis-a-vis the potential harmful effects to environment, to ecosystem, which can increase exposure of public and private investments to disaster risk. How you decide on the location of urban and coastal settlements, which can actually increase exposure of a high number and density of population to hazards of climate change, including, of course, extreme weather events, floods, landslides, and, of course, geological risks such as earthquakes and tsunamis. Now, with climate change, in fact, risk has become more unpredictable and uncertain. More so, the human-induced anthropogenic climate change become more apparent in their contribution to the severity, frequency, and intensity of future disasters to come. And here, I would encourage researchers among this group to look at the counterfactuals. We have been framing the past in terms of cause and effect. The earthquake happened, the effects will be this. The tsunami will happen, the effects will be this. But with climate change, a lot of this what if scenario will increase in terms of what will be their influence on what the future could be. So the past is no longer a good predictor of what disasters can happen in the future. We therefore ought to recognize that some of today's problem came from yesterday's policies and solutions. We need to have a different way of understanding the complexity of risk, which I call the Risk Nexus. How we plan to design and work together through system thinking to deal with complexity. And we have to recognize that we fail more often, not because we fail to solve the problems which we are doing, but because we fail to face the right problem. First, what is different? How should we address these challenges? First, a definition on how we understand risk. A different way of a problem definition. For some of us who are working on humanitarian, we are encouraged and obliged to talk about development interventions in the humanitarian field. for those who are working in the broader sector, in development, in climate, in poverty, in gender inequality, and all other forms of inequality, there are also the risk nexus. And these are multidimensional and interconnected. We are experiencing this with the pandemic today. For some areas, risk is systemic, where simultaneous crises and effects are cascading in almost all sectors from compounded effects of different hazards. I'm one of those who have been teaching hazard is the equation that results from hazard, vulnerability, and inadequate capability. I don't think that's simplistic equation is enough to describe the complexity of the challenges that we face. Risks we are facing are due to the interconnected vectors. We have different vectors now coming from different sources and directions, and that the currently the most appropriate way of looking at it is the risk nexus. And what are these? Let me just quickly describe my thinking about this. The risk and climate, and what's the implication of this? Despite of our 30 years of big gains in DRR, mortality are being reduced because of early warning system. This can be eroded by climate change impacts, where extreme weather events and seasonal variabilities will exceed preparedness and mitigation actions. How would you prepare for a scenario that is outside of the historical regime of people and communities that have not experienced this before? This will change the way we should be thinking about risk and preparedness and mitigation action and disaster risk reduction. The second one is risk and poverty nexus. The increasing in number and worsening multi-poverty dimensions will overstretch capability, availability, and access of poor population to basic services, and many will have no choice but to live in high disaster exposure areas simply because they have no choice. And the third risk nexus is the risk inequality. People, for example, people with disabilities, women and girls, migrants and displaced population, indigenous population, and other categories will be hardest hit in numbers and intensity due to the increasing frequency of disasters and climate change impact. I'll show you an illustration of what it looks like in terms of being left behind in development, that the benefits of development and DRR are not equally or accessible to many, and therefore there's privatization of benefits, and the other side of the coin is the socialization of risk. Second way of looking at addressing this challenge, a different way on how we plan to work together through system thinking and design to deal with complexity is also important. This is a question asked by Takako earlier. Consider yourself or myself on how the individuals or sectors with a specific mandate, the most obstructive way to define a problem is the tendency to define it in terms of the solution I or you already have, or ignoring what others' perspective and solutions that it can bring. It's an elaboration of Bapon's response to Takako. How do we bring together the different sectors? We need to work together in defining the common problem, which is complex, and how we can collectively address this problem. To repeat, we should realize that many of today's problems resulted from yesterday's solution, and notably siloed sectoral strategies and poorly enforced accountability for protecting assets and development gains. By way of example, a simple example, debate continues. Who is accountable to deaths among school children due to school building collapsing following an earthquake? Is it the education department, the public works, the local government, the private sector? In response, we ought to embark on new ways. This is the application of systems thinking and design in DRR, and I will show you briefly some illustrations. Look at the SDG, for example. There are 17 SDGs. They are not designed to be siloed. They are designed to be interconnected. And DRR and climate change adaptation and mitigation will have to look at how to connect with this and why. Yeah, investment infrastructure, for example, are very important and crucial in achieving this SDG. You cannot achieve health and well-being if you don't have good public health system. You cannot achieve quality education if you don't have good schools, and so forth and so on. However, in a study undertaken in the GARD 2015, examples in other countries with inadequate efforts and business as usual DRM, historically, annual average losses represents 30% of capital investment, 30% loss, 30 cents loss for every $1 spent on investments. UNDP is applying system thinking approach. Let's just take, for example, SDG 11, Sustainable Cities and Communities. We supported this process in Colombo and Sri Lanka, and here you see the interconnectedness of blocks of components of what is a sustainable city and community. It involves resiliency block, safe, inclusive, and sustainable cities, and they're all interconnected. And when we conducted a system design workshop in Colombo, many of the participants talk about the strong connection between the historic floods in 2017 with poor solid waste management, not setting aside the contribution of intense rainfall that prevailed in longer than average days or increasing seasonal variability. This is not unique in Sri Lanka. I was one of those evaluation teams. Uh, why do I get a warning? Can I have 3 more minutes, 5 minutes? Then I'll reach 20 minutes of my time.
Yeah, you still have time, Sunny. 3 minutes is fine.
Yeah, because others have not received a warning, right? Okay, let's move to the next slide. Now, it's not just infrastructure alone. Slide 15. Investing on resiliency, sustainability, and inclusiveness is also important in social expenditure, whether it's poverty alleviation or gender equality. These are all very important. But with inadequate resiliency measures, historically, the annual average loss is about 20% of social expenditure. So we're losing 20 cents up to with $1 investment in social expenditure. The next related point is one of the most important aspect of the Sustainable Development Goal for UNDP, which is the Leave No One Behind agenda. These slides show how we can define and identify those who are left behind. Let's take, for example, disasters. Shocks and fragility are important contributors. Now we know the typology, who are the most vulnerable. Many research are pointing to who are the most vulnerable. But what does it mean to leave no one behind? With the adoption of the 2030 Agenda for Sustainable Development, 193 United Nations member states pledged to ensure that no one is left behind and to endeavor to reach the farthest behind first. In practice, this means taking explicit actions, development actions to end extreme poverty, curb inequalities, confront discrimination, and fast track progress for those the farthest behind. Let's take some of these factors. And in fact, they are interconnectedness. And in some cases, a vulnerable group has intersectional factors affecting all of this. Shocks and fragility. The question for researchers and universities is that who is more exposed and who's most vulnerable to setbacks due to the impacts of climate change? Who lost crucial support when disasters happen? Who has very limited access to relief infrastructure that you are bringing in? Recovery, in fact, of infrastructure is an opportunity to consider universal access. For example, we're doing that, for example, in Palu and following the tsunami that happened in Palu in Central Sulawesi with UNDP and local government. Another one is discrimination. Biases and stigma associated with PWD have been excluded in employment. Now, let me quote a UNDRR study in 2013 for 137 counties. 85% have not participated in community disaster management and risk reduction processes. People with disability are excluded from community-based disaster management process, more so in national DRR strategies and national action plans. I'll just talk about the one, and I will not talk about the others. Governance. Where do people face disadvantage due to unaccountable or unresponsive global, national, or subnational institutions? Who is affected by inequitable, inadequate, or unjust laws, policies, process, or budgets? Who is less or unable to gain influence or participate meaningfully in the decisions that impact them? I think in summary, when we look at what we should be changing is how we practice risk management within the context of the broader governance. Governance not in the sense of government, but also how we, whether we're private sector, academe, community-based organizations, civil societies, NGO, government, how we work together in ensuring that risks are not disproportionately affecting those who are left behind, and the benefits of our work are also accessible to others. How do we do this in terms of investment? This slide suggests that non-DRR agenda like poverty eradication, gender equality, where the work in city and climate action can bring resilience and reduce disaster risk through transformative vulnerability reduction. Next suggestion. We can look at investments that are standalone and mainstream, but also reducing investments that contribute to vulnerability and hazard probability. The challenge is to develop and implement a balance sheet of DRR expenditures, ideally more, and expenditures that create risk, ideally less. More final comments. Let us challenge the status quo and show how the benefits of a system approach, breaking silos and shifting our mindset, actions toward interconnectedness. The reduction in mortality is meaningless if this happens only in middle income countries and developed countries, and if these trends are continuously happening and increasing in poor and developing countries. The reduction of economic costs sounds hollow if these accrue only to big capital and industries, but increasing in micro and small industries for farmers and fisherfolk and day wage workers. The reduction of affected population is unequal if more women, girls, and PWDs are suffering. The reduction of loss to infrastructure is imbalanced if these accrue to urban infrastructure, not in majority rural area where majority people depend on their livelihood. There are systems within systems, systemic challenges within systemic changes. UNDP's key message that there are systemic challenges and they cannot be addressed by a single archetype. And what we need is challenging the status quo and need much better archetype in promoting risk-informed development. Thank you for listening. I'll be happy to answer questions.
Thank you so much, Danny, for your wonderful presentations. And also, you brought up very important issues such as development and also the connecting the SDGs into DRR. And also, I was quite, that you also brought a very, very big issue, resiliency for those who are left behind. That is much more, I think it's bigger issue in SDGs, because we are trying to focus on the 17 goals, but rather I think we have much bigger issues behind on 17 goals. Okay, so we have a question. And what do you think is the relationship between resilience and sustainability or sustainable development?
Well, the obvious answer is that they're strongly connected, right? But I think resiliency, the way we look at this from the perspective of risk, is that the resiliency agenda is important in achieving sustainable development. Without risk informing our work, whether we are in environment, in schools, in health, in livelihoods, you cannot achieve sustainable development without incorporating risk reduction and resiliency measures. The other part of this is that resiliency is one of the outcome of sustainable development, which means, as climate and global warming continue to worsen, the barrier and the challenges continue to be higher and higher, and therefore it cannot be sustainable if we are not able to adapt to the changing climate. For example, it is what I call counterfactuals. The IPCC report talk about 1.5 degrees Celsius and 2 degrees Celsius, which is very likely in the next 10 years or 20 years even. And we don't even know. We have not have experienced a 1.5 degrees Celsius hot Earth or 2 degrees Celsius. We are about 1 point something, 1.02. So the counterfactuals are very difficult. So these are all both outcome, but I like to address it in terms of the challenges, that the interconnectedness of the challenges, that they are very important to reinforce each other.
Thank you, Sunny, for your answer. And also you brought up issue of investment. And this is also the topic we have been discussing so many years, and still lacking the funding for disaster risk reduction compared to response and recovery. So what is the problem? Why we are still lacking the funding for DRR, and what should we do to reduce and tackle those issues?
Well, I hope that that this is a question for everyone to deal with, no? Including in your own university. Why is DRR education not well funded? An important part of that is the notion that disasters are exogenous. They are caused by external factors which we cannot control, and therefore for many universities, especially during my time from 30 years ago, funding are actually more for understanding the exogenous factors, such as physical science, understanding the characteristics of earthquake, the characteristics of a tsunami, and that continued to be the trend. Where funding is lacking is the interconnectedness of how vulnerability is a more important contributor to disaster risk, and we know in the pandemic this is become more apparent. So my suggestion here is the characterization of the problem ought to be to adapt or to change or to evolve in what's relevant today. What's relevant today is vulnerability. What's relevant today is that development are not risk informed, and this is where I think we should focus our research, our funding, because these are very important changes and challenges, and we have to cope up with the time. You cannot go to another funding agency for risk assessment anymore. When I started at UNDP in 2015, 2005, there were a lot of money for risk assessment. Right now you cannot look for it, but given that, what should be your pitch should be, of course, more on vulnerability, in my view.
Yes, thank you so much, Sunny. It's a great suggestion. That's actually we are the ones who have to work on and learn more to identify what is the rather important and topics at this current situation and days. Okay, so thank you, Sunny, once again, and I hope we can keep learning together and collaborate for future disaster risk reduction.
Looking forward.
Thank you so much,
Sunny.
Thank
you so much.
Thank you. Okay, so that is all for today's session. I'd like to extend our sincere appreciation to all speakers for their participation and excellent presentations today. And also our appreciation goes to the audience and who joined us today, all of you. And I hope you enjoyed the session and learned from the excellent presentations given today. And please be informed that the recording and the slides shown today will be shared on the APRU website. And also, I'd like to inform you of the upcoming virtual APRU multi-hazard symposium to be hosted by University of Indonesia. That will be conducted on 24th and 25th. And the abstract for presentations has been already closed, but still possible for you to join the session, and still the registration is open, as in to join as an audience. And lastly, and not that least, I appreciate the wonderful support provided by the APLU International Secretariat for its operation and promoting this webinar from Hong Kong, as well as my colleagues here at Iridis for the indispensable support. All right, so I hope I'm looking forward to your participation in our future activities and the APLU Multi-Hazards Program. So thank you so much and have a great day or have a good night. Thank you.
Thank you.
Thanks a lot.
Thank you.
Bye.